Hi, I'm Ed Roth. I'm a program assistant with the SHINE program.
And hi, my name is Kerry, Faria. Welcome back to Medicare and More. We're very glad to have you back. And this is the show that helps people understand their Medicare benefits and any other public assistance benefits you might be eligible for. And my name is Kerry Faria, and I am the Region Director of the Central Massachusetts area. So Ed, what are we going to talk about today?
Well, Kerry, I thought that might be a good opportunity, if we thought about this probably for about 6 months now, is to talk about veterans benefits. In particular, Chapter 115, which is a program that is it's provided through the Commonwealth of Massachusetts to the cities and towns to help some of our more economically deprived widows and veterans with their health care costs.
So that's very interesting. So this is a program, Chapter 115, is actually a program that's beyond the federal VA benefits.
That's correct. It's beyond the federal VA benefits. It's provided through legislation, Chapter 115 of the Commonwealth of Massachusetts, and what it does, it funds the cities and towns to provide benefits to those widows of veterans and veterans who are below a certain income level, and that income level is 200% of the federal poverty level. And if their income is below that level, people can actually have their health care benefits subsidized and paid for by the cities and towns.
That's very interesting. So can you tell me a little bit more about how this works? So let's say I'm a veteran or I'm the widow of a veteran. I think I might be eligible. So what's my first step? What do I need to do?
Well, your first step, the program goes through the cities and towns, goes through the town you live in. The first step would be to contact the town, make an appointment with the Veterans Services Officer, and each town has one. Each town is supposed to have a Veterans Service Officer by law. The Commonwealth of Massachusetts says they have to have a person in each town to provide assistance to veterans and their families, including widows of their families. Contact the Veterans Service Officer and tell them you're interested in making out a Chapter 115 application. Now, that Veterans Service Officer is required to fill out an application and submit it to the state to see if you qualify for these very important benefits. And again, if your income is below 200% of the federal poverty level, and right now that's a considerable amount of money. It's $1,980. So if you're single and your income is below $1,980 and your assets or resources are below $5,000, you may be eligible for this important program. And it provides a whole myriad of benefits to folks.
So if I go into my Veteran Service Officer and I tell them I'm interested in Chapter 115 and applying for that, and I've known my Veteran Service Officer for quite a while, and then they're like, I know you. I know you're not going to qualify. So, yeah, no, you're not going to qualify. Is that something that should be happening or not?
Well, it shouldn't be happening. And if the fact of the matter is, okay, the Veteran Service Officer has to submit that application. He should help you with that application. And you're going to have to provide some documentation, understandably. You're going to provide a copy of the discharge, the DD-214 or the DD-214 of your spouse. So that's an important document. You should always hold on to it and provide income documentation to verify your income. Now, as far as resources goes, your automobile and your house don't count as resources. Now, if you have a second home or you have resources that are above $5,000, CDs, IRAs, or amount of money in the bank, a retirement fund, or you get more income other than Social Security, well, that's a different story, okay? But again, you're entitled to fill out that application. And the benefits it can provide to folks, we see people come into the office all the time who might make $1,200 a month and are struggling. And they have a health plan that that is costing them co-pays and deductibles. They have a high-cost drug plan or something like that, and that's exactly where this program come in. And I want to emphasize one thing to folks also, Kerry, that this isn't charity. This is an entitlement, okay? This is an entitlement to the veteran, or in some cases, the veteran's widows, that through the Veteran Services, he's entitled to. It's not charity. It's just like when you bought your home. You had the GI Bill. Or you went to school. You went to school on a GI Bill, okay? Those are entitlements, okay? You got entitled to by your service. So important programs, we need to see them maximized a little bit more, because I think there's a lot of people that might be missing the boat in this thing. And what they can do, if you have a Medigap program, they can pay the Medigap policy for you. If you have they can pay your Medicare Part B for you. They can help you with the cost of a drug plan. Any medical cost you have, you can be reimbursed for. So again, I mean, as our program has done all along since we've had these series of programs, we want to let folks know about programs and services that they can get to help them with their Medicare, and this is one of them. We hate to see people that are struggling in the community if they're eligible for this very good program.
So after the application is taken, there's going to be an application that's actually formally taken. Usually it's over the computer, is my understanding. There's an actual application that's electronic. So it's done over the computer, and then it's sent into the Veteran Services here in Massachusetts, and then it's approved or it's disapproved. So there's a formal process that goes with that. So as a result of that application, in the end, if someone is approved, you're going to get a letter stating you're approved and what you're approved for. And the reverse is true. If you're denied, you're going to receive a letter stating that you're denied and what you're denied for. So again, one of the emphasis that I would like to make is that there's a formal process for this. So when you do talk to a veterans agent of some sort, there shouldn't be any sort of like, yeah, I know you don't qualify kind of thing. They really need to be taking your information, they need to be putting it into the computer system and doing that application and sending that on to the state office to be processed. And the reason why I'm emphasizing this is sometimes we hear stories. Unfortunately, sometimes we'll hear a story from a veteran who says, no, the VSO or the Veteran Service Officer in my area didn't even take an application. They just didn't think I would qualify. That's not how it works. So the other part to that, to kind of segue that, is if a veteran is not, or a widow of a veteran, is really not getting any satisfaction from their VSO, is there anything they can do about that, Ed?
Well, they can give us a call and we can see if we can intervene. Sometimes we can maybe call at the state level to see if we can have them intervene in a case. But again, the assembly of the information, and you have to, an application has to be submitted. Absolutely. The VSO has to make it. He can give you an application. If you're having problems with the application, he should help you. If there's a question there you can't hook up, bring it in, see your Shine counselor, give us a call, and we'll see if we can help you with the application. It's fairly basic material. Again, it's income documentation and stuff like that, your mortgage situation, whatever you might be, okay? It might appear to be onerous. It's not that bad, okay? It's not really that bad. So we encourage veterans, now widows of veterans, to really jump on this thing if they can, because your health insurance is getting more and more expensive, and getting more and more complicated, and this is a way for our heroes and their families to really get some benefits that they really need. So again, Chapter 115, Veterans Benefits. It's an entitlement. It isn't charity. Okay, it isn't charity. The cities that don't worry about your tax rates, the cities and towns don't get burnt that much. What happens is very simply this: the cities and towns are reimbursed by the state at 75% for the cost of the program, okay? Simple as that, okay? It's not a budget killer. It's not a budget killer. And I can guarantee you that any selectman or any mayor of a city, okay, is enthusiastic of helping the veterans and the widows of veterans in their city or town. So just don't feel it's going to be a burdensome or something. Don't feel that way, okay? It's a program you're entitled to. Take advantage of it, because it's just out there for you. I love veterans, and having served myself, I just think this is a program that's really not used as much as it should be.
And so let's say, just as a further thought on that, I'm a veteran again, or a widow of a veteran, and I really like my doctor though. What if I don't want to change my doctor? What if I'm afraid of changing my insurance, or maybe I'm a little concerned about getting involved with the veterans system because I hear some things about that. Does this Chapter 115 affect that at all?
Well, if you're in your case there, you have your doctor, you like the doctor you have, all Chapter 115 is going to do is going to help you pay for your plan. Now, a wonderful thing about Chapter 115 is if you do have a Medicare health plan like a Fallon or a Tufts, well, you've got to go and bring in your bills. You've got to submit your bills to the Veteran Service Officer for payment, because it's a reimbursable deal, okay? But if you're in a Medicare Medigap plan or a Medicare supplement plan like a Blue Cross Blue Shield Supplement 1, it's a little more expensive, but you get on with that bill once a month, you submit it to the veterans agent, you're reimbursed, and you don't have to get on there with your bills every couple of months or something to get reimbursed. So that saves them some money as well. And with the Medicare supplement plan, the wonderful part of those plans, and we've talked about this before, is that you can see any doctor or go to any hospital that takes Medicare. It's really the best plan that you can get. And somebody that can't afford that, this may be your avenue to really get a Medicare supplement plan that will give you maximum coverage to supplement your Medicare. And it's there for you, and we encourage folks to really take advantage of this program.
And just to kind of reiterate a little bit, the program is a bit more complex than we've let it seem to be. So there are varying circumstances. So maybe you were a widow of a veteran for a long time, but maybe you remarried. I know under some circumstances you can still get benefits. So if maybe you're a child of a veteran and the veteran passed away during wartime. I mean, so there's a variety, of different circumstances. So there's no harm in checking, I guess, is what I want to say. If you don't deny yourself to see if you're eligible, just look into it. Just see if you are eligible. Who knows? You might be eligible and you never even realized it. Because the state's been very generous. The state of Massachusetts has been very generous. This is only a program that's offered here in Massachusetts. I don't know of it being offered in any other state. So this is beyond the normal federal veterans benefits. This is actually benefits that the state of Massachusetts created right here for veterans and their families in this state. So, and as Ed has said several times, we ought to be using that. So if you think you even remotely might be eligible, boy, it'd be really good if you checked into it and go to your local town, make an appointment to see that veteran service officer and see if you're eligible for any benefits.
And again, this is in addition to your regular VA benefits you may be eligible for. And again, that veteran service officer is a guy you got to talk, guy or gal, there's a number of ladies in the business, and that's the person you got to talk to. He can explain to you all of your benefits under the VA, whether it be the VA health system or whatever it may be. If VA health system is a little bit different because you're restricted by the time you served, and Vietnam, you need to have time in the Vietnam area or different eras. But VA benefits are outstanding. I mean, you can get hearing aids through the VA. You can get eyeglasses through the VA. There's all kinds of assistance you can get through the VA that are very, very economical. Okay, very economical, and you'll be surprised at the ability to get that. So please, always consider the VA as assistance with your health care. You don't have to be a disabled vet. You can You can be, depending on the time of service, depending on when you served, you certainly can get benefits through the VA health system. It's there for you, and it works. You know, I know it's getting battered around a little bit now, but it's a system that can work for you, okay? So again, if you're patient and can use the system, I know I've used it a couple of times myself, and it's been very, very worthwhile for me to use. So again, that's just another aid for our folks that will help them with your Medicare and provide different services like hearing aids, eyeglasses, may help you with other durable medical equipment you may need. Certainly can help you with aid and assistance if you're going into a nursing home or something like that. All kinds of things that your VA, your Veteran Service Officer will be aware of to let you know if you're eligible or not. Eligibility is different, but to let you know where you can go to get this assistance.
Well, I think at this time we're going to talk a little bit about public benefits, if I'm not mistaken.
I'd like to, Kerry. I'd like to see, I know public benefits, what we call public benefits, different benefits that are available to assist folks with their Medicare costs. And usually every year in March or April, they tend to increase. Mm-hmm. The benefits increase, and the amount you can earn before the amount you can earn goes up a little bit, so you can access public benefits a little bit easier. So I know the first one I'd like to talk about, and it doesn't really come up, it isn't come under the income limit too much, but Prescription Advantage. We've had Kathy Campbell on before, but maybe we can just review Prescription Advantage a little bit to see where you think how that's changed going forward. Is it the same? What's happening with Prescription Advantage? A couple of minutes.
Well, Prescription Advantage actually is staying the same. I don't know of any changes. And it's a wonderful benefit that, again, is kind of underutilized here. So we really ought to be taking advantage of that. And it's not a prescription drug program. A lot of people get a little hung up on the name, but Prescription Advantage helps a person pay for their prescriptions when they hit the donut hole. It depends on what your income is. But when you hit that coverage gap or when you hit that donut hole, and boy, we've seen a recent flurry of those people calling our office to get some help paying their drugs, that's when that program kicks in and it helps to subsidize the cost of their drugs. Just the other day I had a lady call who was getting medications at a fairly decent price, and now her medications were going to cost her $200 a month. And based on where she was going to fall with Prescription Advantage, once she became a member, she was going to pay $30 for that medication. So what a huge help that could be. So Prescription Advantage is a very user-friendly program. The income guidelines are very generous. They do not even look at assets. So it doesn't matter if you own your house. It doesn't matter if you have a car. It doesn't matter if you have assets like a 401k. None of that matters. They just look at, okay, what is the income coming into the home per month? And then based on where you fall on that level, then they figure out which sort of subsidy you're going to get. But this time of year, we're really beginning to see some people calling because they've hit the donut hole. So another worthwhile free program that people really need to take advantage of and to be accessing. And for individuals of higher income, there's even another level that they can get into where they might have to pay a small fee, but those are people that have really, really high expensive medical costs, medication costs. I want to be specific about that. But the income guidelines are quite generous. So again, a program that's underutilized, and people really need to be taking advantage of it.
I agree with you, Kerry. And to reiterate, and I just want to put these income guidelines at you a little bit. We normally don't like to do it, but if you're an individual and your income is below $2,970 a month, that's $2,970 a month if you're an individual. And if you're a couple, husband and wife, and your income is below $4,005 a month, okay, you can get Prescription Advantage at no cost. It does. The only thing it costs you is 20 minutes or 30 minutes to make out the application and send it into Prescription Advantage. Now, we get the story, well, it's not going to help me. Well, here's my honest view of that. Yes, it might not help you right now, but if you get a medication that's going to cost you thousands of dollars, and it's on a plan's formulary, and Prescription Advantage is only going to charge you $30. That plan helps you, okay? That plan helps you. So it will help. And amazingly, in talking to Kathy Devine, who was on with us a while back, membership was dropped off. We don't know why. But again, if you're qualified, call us. We'll send you an application. Go online. You can do an application. Go to the Shine website and hit resources, Prescription Advantage. There's an application there online that you can do and submit it. Takes a few minutes, and it's a benefit that can save you literally hundreds and thousands of dollars in prescriptions costs if you hit that donut hole. And don't think that, it's not going to happen. Well, guess what, folks, okay? We're aging all the time. There's all kinds of prescriptions to keep us healthy, but they cost money. And we don't want to get into a situation where they become unaffordable. When you can get an affordable program that will help you with those prescriptions, also would give you a special enrollment once a year to change your prescription plan if you have to. Really a sensational program that we encourage folks to get involved with, do online. If they ask you where you heard about it, tell them you heard about it on the Medicare and More program. We'd be happy about that. But again, we encourage you to join Prescription Advantage. Each and every one of you out there who can meet those guidelines. And we're going to put a slide up on the screen to exactly what those guidelines are, just if you want to have your loved ones and your caregivers review this program. Kerry, also, Mass Health Buy-In is a program that I think we might want to talk about a little bit.
The Mass Health Buy-In is it's an interesting program. It's also a very nice program. And what that does is if a person qualifies, then it pays for the Medicare Part B premium the person's paying for. So for people that had Medicare last year and rolled into 2016, that would be $104.90. Well, the state would pay that. Or if you're new to Medicare in 2016, you're paying $121.80. So again, the state would pay that. So instead of you seeing that money deducted out of your Social Security check, now you're going to see the whole amount of your check if the state pays that on your behalf. So again, a really good benefit. And not only does it pay for the Part B premium, but it also allows a person to be subsidized on their medications. So again, a really nice benefit that should be taken advantage of. There are income guidelines on this particular program, but this particular program also has asset guidelines. So if you're curious as to what those are, you can certainly give us a call. We'll screen you to see if you're eligible for any programs whatsoever. We'd be very happy to do that for you. And again, it's a great benefit, and it helps people to afford their insurance a little better. It's a good option.
And again, all of Mass Health Buy-In it's $120 in your pocket every month.
Right.
That you're paying now for your Medicare Part B, if you qualify. Again, excellent program. Puts a few dollars in your pocket, and it works. And as Kerry mentioned, if you get Mass Health Buy-In, you're also going to be able to get extra help from Social Security. Kerry, how does extra help work?
Extra Help is a program through the federal government again, and what that does is that helps a person pay on their drug plan. So it can help pay for the premium, the monthly premium. It can take away the deductible, or it can subsidize it, or, and I shouldn't say or, and it helps a person just to have copays on their medications. So again, can pay up to $30 on a premium of a drug plan, can either take away the deductible or subsidize it greatly, and now you've got fixed copays on your drugs. So no more of this fluctuating through different payment times during the enrollment year with your drug plan. So it really stabilizes how much you pay. It's a really, really good benefit which people should avail themselves of. So next, though, I think we're going to talk a little bit about the health safety net to kind of wrap up.
Yeah, let's wrap up with the health safety net, Kerry. And I know in June, earlier this month, there were some significant changes to the health safety net. The health safety net used to provide help to folks who were below 200% of the federal poverty level. Well, effective on June 23rd, I believe, that changed. So your income has to be below 150% of the federal poverty level. And the range for health safety net now is between 150% and 300% of the federal poverty level. So that's the eligibility requirements now for health safety net. Now, anybody that's had it, they're okay probably until they get a review letter. You receive a letter from Mass Health to ask you to provide them with information, update Mass Health's information, your income and status, so they can make a determination whether you'll continue with the health safety net. But again, health safety net is the program that will pay that hospital deductible for you if you go into the hospital. It'll pay your hospital deductible for you if you're in a Medicare health plan. So that's a very important program. And actually, if you get all of your services at either an acute care hospital or a community health center, it'll pay all of your co-pays. So again, a very healthy, very good program. Unfortunately, the guidelines have changed, so it's not going to be as full anymore as it used to be. But we want to see, again, it's out there for you. Please feel free, give us a call. We'll set you up with an application. And a very good program to help people with these costs, and they can be significant. We've had people talk to us about the health safety net. Based on their eligibility, we've recommended different things for them. Can you talk about that for a minute, Kerry?
Yeah, so we've had some cases where maybe an individual has had some medications, they're hard to fill. And so because a person who has health safety net can go to a community health clinic or to an acute care hospital that has a pharmacy and get their medications filled through the hospital pharmacy, many times the medication will be covered through the health safety net instead of their Part D plan, either the standalone Part D plan or through their Medicare health plan. And so we've referred people to get their medications filled at acute care hospital instead, and it saved them a lot of money. So it's a really good program that we need to be, again, using. Yes, there's been some changes to the guidelines, but it's still viable, it's still there, and it's free. Everything we've mentioned today is free. So again, we just really want to make sure that people are aware of their options out there.
And I think that's going to be a wrap. In conclusion, I got 30 seconds. We've talked to people about getting into a Medigap or a supplement core program. And the health safety net was a great wraparound for that. And that's the only thing that it wrapped around that, and it paid the hospital deductible that the core doesn't pay. Okay? Well, thank you all for watching. And
yes.
I guess we'll see you next month.
Next episode.
Our next program, next time.
Yes, next episode. Thank you for watching.